Are you struggling with acid reflux? Do you have heartburn, chest pain after eating, a lump in the throat, or difficulty swallowing? These can all be signs of acid reflux, and you could even be eating foods that are making it worse. In this video, we're going to discuss how to naturally eliminate acid reflux altogether. Stay tuned. Hi everyone, I'm Dr. Tiffany and I'm a naturopathic doctor in the GTA and a member of the Vitamart educational team. Acid reflux has many symptoms and it's different for everybody. Some of the less common symptoms of acid reflux include hoarseness of the voice. You can get the feeling of something rising up from your stomach, and that can be worse lying down. You might get a chronic cough or a wheeze, or a sour taste in your mouth. When we experience acid reflux over a long term, we call it GERD, and that stands for gastroesophageal reflux disease. The amazing news is that there are tons of natural ways to help with GERD, and not just eliminating the symptom, but actually helping the underlying cause long term. So over the next few minutes, we're going to discuss these natural remedies for acid reflux. So before we get into the nitty-gritty, I just want to remind everyone that just because supplements can be quote-unquote natural, it doesn't necessarily mean they are safe or without risk. So please discuss everything with your healthcare provider first. Okay, so let's talk heartburn. First, we're going to chat about some supplements that can be used for symptom relief, and then we'll get into sort of the long-term how to fix the underlying cause. So essentially, when we're dealing with acid reflux or heartburn, we're basically getting all of these digestive juices, the acidic juices from your stomach, rising up through this sphincter. And the sphincter is essentially a circular muscle between the stomach and the throat that's supposed to keep everything down in the stomach. So essentially, when we're treating heartburn, we can go two ways. One is to sort of help the tone of that sphincter to keep everything down. And the other option would be to take something to kind of coat the throat so you're not feeling the acid coming up in your throat as intensely. I recommend using these things as sort of a band-aid for symptom relief while we work on that underlying cause over the long term. My go-to treatment for patients with heartburn in my office is DGL, and that stands for deglycerided licorice. So this supplement comes as either a capsule or a chewable, and it does taste like black licorice, and I find that's a taste that people either really like or really dislike. The way we dose this is I usually start with 200 to 400 milligrams, and you want to take this 15 to 20 minutes before meals, especially if you're going to eat something that typically causes you heartburn. There are a couple of other herbal options that work very similarly to DGL to kind of coat the throat. So we're going to talk about althea, slippery elm, and aloe vera. So althea, otherwise known as marshmallow, is a fan favorite, of course. You can take this one as a tincture. And St. Francis is an amazing herbal brand that has marshmallow available as a tincture. Watch out for the taste with tinctures, but again, you can just take this as a liquid a couple of times a day to coat the throat. Another option, as I mentioned, is slippery elm. Slippery elm is a good one that's taken as a powder, kind of mixed with water. So it's another great option for those of us who don't love swallowing pills. And aloe vera is another herb that people are quite familiar with for sunburns, but it's also lovely for sort of healing the digestive tract. So Land Art has a great liquid version of aloe vera that is quite soothing. On another note, there is some research to indicate that melatonin at 6 milligrams per day can be useful in managing acid reflux as well. Now, melatonin on its own is not going to solve the problem, but it could be a useful add-on if you're somebody who also struggles with constipation or insomnia. Now, be careful with melatonin. It can make some people groggy, so make sure you start with a low dose and work upwards. Okay, so now on to the long-term solutions. Basically, when we look at acid reflux, there are two main categories that people fall into. And it's going to seem kind of weird because there are two groups of seemingly opposite problems that end up with the same effect. So the first group of people is people with too much stomach acid. That second group of people is, and I told you this is going to sound impossible, the second group of people is those with too little stomach acid. And ironically, this is the group that I see most often in practice. Now, there's a fancy medical word for low stomach acid, and it's called hypochlorhydria. And with this, we get a lot of digestive concerns, heartburn being one of them. So like I said, this is the most common problem that I see in my office, these people with too low stomach acid. And the frustrating part is that our go-to in the medical community for heartburn is an antacid. So if we think about those two groups of people, the antacid is going to be super helpful for that small group of people who have too much stomach acid. But it's actually going to make the problem worse for that other category of people that have too little stomach acid. There is a test you can get done with your naturopath to test your stomach acid levels if you are super interested or if you're not quite sure where to start with your treatment. So you can be sure to inquire about that. So for long-term treatment to help reverse the low stomach acid, my first step is always one of two. If you like the taste of apple cider vinegar and you've got some at home, you can give that a try first. You'll take a little bit, maybe a teaspoon or a tablespoon, in a bit of water, again 15 to 20 minutes before meals, and that helps to kind of get the digestion process started before the food actually arrives 20 minutes later. So that's the first option, and that should reduce acid reflux, bloating, all that stuff. If you don't love apple cider vinegar, there is another option. St. Francis, again, has a great blend of bitter herbs. So it's called Canadian bitters. And these again act in the same way to kind of prep the digestive system for when the food arrives. And I find that this is all that's really needed most of the time. It's great for reducing acid reflux, bloating, and even nausea. So definitely give this stuff a try. So that's always step one, and typically, again, that's all that's needed. Eventually you start to wean down, maybe you go down to just 2 meals a day or just 1 meal a day, and then eventually you shouldn't need it at all. So this is a long-term solution to GERD. If this isn't strong enough and you do have confirmed hypochlorhydria, you can try something called a hydrochloric acid challenge, but you should not do this unless you are supervised by a healthcare professional. Alright, so some other supplements you can try are phosphatidylcholine, dosed a few times a day for about 3 months. That one is particularly helpful in pregnancy. It actually acts to close that sphincter we talked about to keep things down. Along the same lines, choline is something else that helps to that tone of the sphincter, so it helps with GERD as well. You may want to consider a digestive enzyme. If there's any sort of digestive deficiency, this can help that along. And keep in mind, when you're looking for a digestive enzyme, you want to have 3 components. You need a lipase, an amylase, and a protease. I am a big fan of the Life Choice Full Spectrum Digestive Enzyme. There are other supplements we can consider too if we're looking at healing the entire digestive system, but perhaps that's a bit of a more comprehensive discussion for another day. And before we finish up, I do want to mention that there are quite a few common trigger foods for GERD. So it could be that you're just consuming too many of these in your diet, and perhaps if you were to cut these out, you wouldn't need any supplements at all to help your symptoms. So one example for you is mint. This actually acts to relax that sphincter we talked about, so it lets more things up and it makes GERD worse. Some other common trigger foods are citrus fruits, coffee, and don't hate me, chocolate. Thanks so much for watching. Again, I'm Dr. Tiffany Zugan. I'm a naturopathic doctor in the GTA and a member of the Vitamart educational team. If you like this video, please subscribe to our YouTube channel. Just hit the subscribe button below. And I want to hear from you. What tips and tricks from this video are you going to try? Are you going to go for the DGL or maybe some apple cider vinegar? Either way, we want to hear from you, so comment below.